Hi, I am Dr. Annamma Thomas, Professor, OBGYN, Rainbow Children's Hospital. Today we are going to talk on decoding menopause. Menopause is a landmark event in the life of a woman. It marks the end of her reproductive career and the beginning of a phase in her life where she is going through a state of hormonal insufficiency. This period, to understand menopause, you need to know the definition of menopause. Menopause, we say, is a period of time which begins after a woman has not had periods for a period of 12 months. This is associated with permanent cessation of ovarian function. The ovary has two functions. One is to produce eggs and the other is to produce hormones. Cessation of both these functions results in menopause. The age of menopause can vary any time between 45 and 55 years of age. The average age of menopause in Western women is 51 years, whereas in the Indian scenario, it becomes a little earlier. That is, it may be any time between 46 years and 48 years. Some women attain menopause earlier, which is before the age of 40. We call this premature menopause, which results from premature ovarian failure. Menopause can also be a little late, that is after the age of 55, when we call it late menopause. It can be associated with malignancies in the breast and in the uterus. Now that you understood what menopause is, we need to also understand there is a period before menopause which spans between 2 and 7 years called perimenopause. Now, this period is associated with certain changes which precede menopause. There can be a variety of symptoms which a woman experiences, ranging from just some transient symptoms like hot flashes, it can be irregularity in periods, can be mood changes, or there can be more permanent changes occurring like changes in the cardiovascular system, changes in the skeletal system, or changes in the brain. Now, I'm going to highlight to you a few of the changes which normally occur in women at this age, and we're going to find simple solutions to these problems. So, helping a woman understand this is very important. What are these changes? The first is in irregular periods. The way the woman attains menopause can be in three different ways. One is she can have regular periods which stop abruptly. The other is where she can have periods which come earlier, maybe once in 20 days, 24 days, and then the period will stop. Or it can be delayed periods which go on getting delayed maybe once in 1.5 months, 2 months, 3 months, 6 months, and then the period abruptly stops. Now, periods can be irregular at this phase due to aging of the eggs, and this irregularity in turn is a result of hormonal imbalance. To correct this, one needs to consult a doctor and correct with hormonal therapy. But one needs to understand that the uterus need not be removed for every woman at this phase of life. The other changes which I would like to talk about is the first is hot flashes. Now, what is hot flashes? It's a thermodysregulatory function of the brain which occurs because of estrogen deficiency. As a consequence of this, the woman experiences a sudden sense of heat in the upper part of the body associated with flushing and followed by a bout of sweating. Imagine when a woman is either at home or in the place of work, it may occur at any time of the day. Either in the night, it wakes her up from night, or it may be in the daytime. If at daytime, an executive or a CEO working in an office, conducting meetings, conducting workshops, suddenly finds herself sweating and all her colleagues asking her, is something wrong with her? What is the problem? It's a very embarrassing situation. She may be at home, a housewife, able to cope with the hot flashes, but sometimes when she's going out for an occasion, she's dressed well, and she's having this hot flashes. Imagine her having to change her clothes another time just to go out because she's sweating. Or it can be waking her up, spoiling her sleep, causing a lot of sleep disturbances. How do we deal with this?